Welcome, Erin. It's great to see you. Dr. Erin Lovett is my partner. She's a excellent gynecologist and an expert in female rejuvenation surgery. In plastic surgery, one of the big trends over the past really few years has been non-surgical options, and this has been, um, I think, a great thing for patients to have options that are not just surgical. And in fact, the vast majority of patients benefit from the non-surgical options. Um, and do you find that the same of the non-surgical options for intimate health and rejuvenation mirrored how good surgery is?
Absolutely. So there are so many options now available for women's intimate health. It's a very exciting time, I think, in medicine and specifically in aesthetic medicine that we are able to offer all of these different options and experiences for women who never knew that they had the ability to change the look or the feel of their intimate area in the past. So for women specifically, that does include things such as fillers for loss of volume for the labia majora. It can include change of pigmentation that they're unhappy with. There's also non-invasive, non-surgical procedures that can improve vaginal laxity, including both laser application. And there's also non-invasive, non-surgical procedures that can increase vaginal lubrication for women either pre or postmenopausal. And similarly, treatment of the pain syndromes is a huge advance that we've been able to offer as well.
Someone experienced a change in the volume of their labia majora with aging.
Mhm.
What can be done to restore the function and comfort that they've lost?
Yeah. Excellent question. So the labia majora is referring to the larger outer lips of the vulva. And usually these are the ones that, so it's a hair bearing area. So a lot of times women are familiar with the area because they see it during shaving. They're aware of it if they undergo laser hair removal. And for some women with aging and childbirth, they notice that what used to be a very cushioned area of the body with fat deposits underneath has become more sagging. So the skin becomes a little looser and they actually lose the volume. So the actual fat volume within that area. And it can be very embarrassing for some women. They find that area to be sagging. It affects their ability to enjoy intimate relations with their partners. And for some, it actually is a physical discomfort because they're missing that cushioning that's required for enjoyment of certain activities. For example, riding a bike or even undergoing other exercises. So there's a number of different things that can be done to help restore the volume of the labia majora. One is very similar, again, to a cosmetic procedure that women are most familiar with for the face, and that's a filler. So that is a hyaluronic acid-based filler that can be injected into the labia majora to restore that volume. And that option is a temporary option because, as most know, you need to keep up with your filler and have a repeat injection once it deflates, essentially. Or for women that are very sure that they would like a more permanent version of recontouring of that area, we can look into a process called fat grafting to the vulva. And that essentially involves harvesting a woman's own fat through liposuction and injecting that into the labia majora.
You have taught me a lot about many of these procedures, and I imagine that women have a hard time learning about much of this, even from their health professionals. Do you find that there's just a general lack of education about these options?
I think it reflects the fact that women's intimate health, when it comes to aesthetics, is a relatively new area of kind of the plastic surgery and gynecology realm. And a lot of these treatments are new because I think it has been very difficult for women in the past to have a voice to say that I'm actually unhappy with this region. Because I think a lot of women have been taught or told to just accept changes that occur with changes in our lives, changes in our hormone profile. And right now, I think what's important is, like any other aspect of aesthetic surgery or treatment, is to listen to our patients' needs and their desires so that we can assist them to be very happy with all aspects of their health. And for women's intimate health, it's not just about, sexual health and well-being. It's about personal acceptance, and sometimes functionality.